Hello and welcome to the next instalment of our digital updates for employers during this coronavirus crisis period. We hope you're all remaining safe and well, and thank you for the feedback that we've receiving about the content that we've been posting so far. So the first update is from something that was reported in The Guardian this week about a potential shortage of cardboard, either across Europe and potentially also a global shortage. Now, this has apparently been caused by the shutdown of recycling plants. Many local authorities have shut down their recycling facilities, so there's less fibre re-entering the manufacturing process. As a result, businesses that rely heavily on cardboard, such as manufacturing, delivery companies, medical and food, may well face a shortage of the material. Now, the suggestion is that you contact your supplier, you see what the supply chain is currently looking like, whether you do need to perhaps increase the amount that you're ordering, what the prices are going to be like over the next few weeks and even months, and we would suggest that you implement some sort of planning in relation to that issue. Secondly, an update in relation to RIDDOR. The HSC has clarified that you must report exposure to coronavirus under the Reporting of Injuries, Diseases and Dangerous Occurrences Regulations 2013. So when is it notifiable? The HSC has identified that there are two types of coronavirus incidents that must be reported under the Reporting of Injuries, Diseases and Dangerous Occurrences Regulations, RIDDOR. These are, number one, an unintended incident at work that has led to somebody's possible or actual exposure to coronavirus. This must be reported as a dangerous occurrence. Or two, a worker has been diagnosed as having COVID-19 and there is reasonable evidence that it was caused by exposure at work. This must be reported as a case of disease. The guidance identifies that a dangerous occurrence is something that happens in the workplace which results in the release or potential escape of coronavirus. This is clarified using the example of, for example, a lab worker breaking a glass vial containing the virus. When it comes to coronavirus being reportable as a work-related disease, the HSE states that if there's a reasonable evidence that someone diagnosed with COVID-19 was likely exposed because of their work, you must report this as an exposure to a biological agent. To add further clarification, it gives the example of a healthcare professional being diagnosed with coronavirus after treating infected patients. What's important is that you don't need to make a report to HSC every time someone self-isolates or reports that they think they have the virus. This guidance makes it clear that for it to be reportable as a work-related disease, the individual must be diagnosed. Plus, there must also be a clear link between their work and their illness. When it comes to the dangerous occurrence, this really only relates to those handling the virus, such as lab technicians or medical professionals. Although you might not need to keep the HSC in the loop, we would suggest that you maintain records to identify how you've dealt with any cases or suspected cases. You might need these at a later date to prove that you have behaved responsibly, and reports must be made where there is a clear link between the work and exposure. In reality, this requirement will only affect lab technicians and healthcare professionals. However, we would suggest that the maintenance of records is kept as a matter of good practice. Our final update today relates to the calling back of workers into the workplace. We've started to see more and more of this over the last week. There's an increase of people out on the roads and there is signs of businesses starting to reopen steadily. I know, for example, lots of my clients have been testing how they can make the workplace safer, moving things around, reconfiguring work areas, making sure that social distancing can be complied with, setting up hygiene stations and undertaking risk assessments within the workplace so that they can ensure that they have a safe environment so that they can start to operate again. Now, obviously, if people can continue to work from home and are effective, there's no reason why that cannot continue. But if you are looking at bringing staff members back, we would suggest that as an absolute minimum, that you review the workplace, have a look to make sure that there are no areas where employees are going to be in close proximity to one another. For example, do you need to close your canteen? Are there any other areas where employees tend to congregate within the workplace that you might need to now look at changing those practices? Undertake a risk assessment and go through each area of your business and see how you can improve safety, cleanliness, and whether you need to increase the provision of any hygiene and cleaning materials. You may need to implement a deep clean of the workplace, for example, or provide wash stations or additional facilities for employees. Once you've reviewed the workplace in practice, you then need to have a look at how those employees are going to work together and the sorts of work they're going to be doing. Are they going to be handling materials that other people have been handling? Are they going to be coming into contact with members of the public where you can't actually vet what they have been doing? This may mean that you can only implement a skeleton staff, or you may need to actually change the way that you work. For example, if you are operating a logistics or haulage business, perhaps you need to take measures such as ensuring that nobody other than the driver touches the vehicle when they go to do a delivery, that you've got provision for perhaps gloves or hand washing facilities in the cabs if they have any buzzers that they need to push to enter gates, and that those who are receiving deliveries at the other end are absolutely clear on what the measures are for those deliveries being dropped off and what the drivers will and will not be doing. Having the measures that you've taken written down, making sure that you have reviewed those before employees start coming back into the workplace will mean that then if you have got any employees who are objecting or raising any issues, that you are well equipped to have those sensible and calm discussions with employees. We would not suggest that this is a time for you to be instantly threatening disciplinary action for someone refusing to come back to work. People are frightened and worried, and we would suggest that you have those reasonable conversations with them, see if you can provide some reassurance, and then if there's still an issue, contact us and we will guide you through what the next steps are to getting someone back into a productive work mode so that you can get your business going again. That's it for today. If you have any queries or any questions, for those of you who have been doing, send them through. So that's alyssa.thursfield@gamblins.co.uk. Thank you very much for continuing to watch and sending the great feedback that we've been getting, and we'll be posting our next new content very soon. Thank you very much.